Our different thromboembolic disorders are varied. The first one is just a thrombi or an emboli. This is undesirable clot formation, and risk factors include atherosclerosis, inflammation, blood stasis or slow flow, or even immobility. The thrombus is a clot that's in an unbroken blood vessel, and it could potentially block circulation, which would be bad. That would lead to ischemia, tissue death, tissue damage. An embolus is a thrombus that's freely flowing in the vasculature, and an embolism is a free-flowing embolus that blocks a vessel. We think of pulmonary or cerebral emboli. Pulmonary embolism or pulmonary embolus can be a really debilitating condition for the lungs that can lead to death. A cerebral emboli could be a stroke that leads to death. Anticoagulants are used then oftentimes to prevent an undesirable clot from being formed. So we think of aspirin as an antiprostaglandin. This inhibits our thromboxane A2. Heparin is oftentimes used pre and post-op to, especially in cardiac care. It's rapid, it can be used acutely, and this prevents venous thrombosis and it binds and can potentiate antithrombin 3. And then warfarin and our direct oral anticoagulants or our DOACs are much more slower and chronic. Warfarin specifically interferes with vitamin K action. It inhibits VCOR C1, that kind of enzyme process. And it depletes active vitamin K, which is specifically used in factors 2, 7, 9, and 10. And all of these can reduce stroke risk in AFib patients. Thrombocytopenia is a condition where we don't have normal clot formation. We have a deficient amount of platelets circulating, and therefore you can see signs of inappropriate bleeding, like petechia, which is shown here, and non-blanching widespread rash. That's due to widespread hemorrhage. You could also see here lots of different etiologies. It could be idiopathic, no known cause, could be due to malignancy or medications, or even anything that suppresses or destroys our red bone marrow. And patients who have this have a concentrated platelet transfusion. There are also bleeding disorders from impaired liver function because we're unable to synthesize our procoagulants or our clotting factors. If we have a vitamin K deficiency or any type of liver disease like cirrhosis or hepatitis, could potentially lead to the inability of producing these factors. We also could see if we are unable to produce adequate bile and unable to absorb adequate fats, we could potentially then see vitamin K absorption decrease, and that could also be detrimental. In a vitamin K deficiency, vitamin K specifically carboxylates glutamic acid in 5 clotting factors: prothrombin, protein C, and factors 7, 9, and 10. Remember, prothrombin is factor 2. And during this process, vitamin K becomes oxidized and inactivated. And then vitamin K epoxide reductase complex, or VCOR C1, reduces vitamin K and reactivates it. This whole process is produced by bacteria in the enzyme, and an etiology in vitamin K deficiency would be if we had any malabsorption of fats, because it is a fat-soluble vitamin. If there's no bile production or delivery due to some sort of fat malabsorption, or if there's liver or biliary disease. So this is showing essentially vitamin K moving throughout, vitamin K being blocked by warfarin in 2 different components. So vitamin K is really not able to go through its normal life cycle. Hemophilia, there's different types of hemophilia, but it's a hereditary bleeding disorder that's X chromosome inheritance pattern, so sex chromosome linked. Therefore, it's more common in AMAB patients because they only need one abnormal chromosome to express the condition. There is hemophilia A, which is most common. They all affect the intrinsic pathway, but hemophilia A affects factor 8. Hemophilia B is factor 9. And hemophilia C is factor 11 and is the most mild. The symptoms would be prolonged bleeding, especially into joint cavities, and you'd want to replete the specific clotting factor synthetically. DIC, or disseminated intravascular coagulation, is not good. It's a thromboembolic and a bleeding disorder. So you have clotting and bleeding at the same time. Clotting happens inside an intact blood vessel, and that leads to blockage of blood flow. And then residual blood is unable to clot elsewhere because the clotting factors are used up and depleted, therefore, bleeding follows. Sepsis or blood infection is common, a potential common cause. Incompatible blood transfusion or even complications of pregnancy can lead to this condition. Speaking of blood transfusions, we're going to get into that next.